Kia ora tātou. We start our daily huddle off with a karakia, which we're going to start today.
Whakatau wairua, rango matane mauri tau, kia u, kia tau. Rongo I te whiwhia, tū I te whiwhia, kia mau I te kupu, kia tipu ai te kupu, ki tōna iho matua, rongo matane mauri tau, kia u, kia tau, whakatau wairua.
Tēnā tātou katoa. Ko te mea tuatahi e mihi ana hau kia koe e matua. Mō nau ngā kupu whakamoemiti ki a mātou I tēnei wā. Tuarua ki ngā hoa o te PHO. Tēnei te mihi nui ki a koutou. Kua tai mai ki te tautoko I a mātou, I a tātou, te whānau o here taunga, te whānau o Ngāti Kahungunu. Tēnei te mihi nui ki a koutou. Ki a koutou katoa, kua piri mai nei ki te rongo, ki te mau I te āhuatanga o tēnei kaupapa, he mihi nui, he mihi aroha ki a koutou. Ko wai mātou, ko Kiri ana pūtō ko ingoa no Ngāti Parau me Ngāti Tūkorihi a hau, he tākuta a hau I te tai whenua o here taunga. Mōrena everybody, thank you very much for the warm welcome. We're very pleased to be here to present today. My name's Dr. Kiri Bird. I'm the Medical Director and General Practitioner for our Māori health provider in the Hawke's Bay, Te Tai Whenua o Here Taunga.
Tēnā koutou katoa, ko Chiltons te maunga, ko Li te awa, ko Kawhili te morai, ko Hertfordshire toko iwi, no Inārangi. Ko Julia Ebett toko ingoa, ko au te pau kai whakahaere heretanga, hore heretanga. Nō reira tēnā koutou, kia ora koutou katoa.
Kia ora, ko Nicola ki Hirini tōku ingoa, ko Ngāti Parau, rawa ko Ngāti Kahungunu, rawa ko Ngaitahu, tōku iwi. I'm Nicola ki Hirini, I'm the Practice Support Manager.
Kia ora, ko Sonia Peterson, tōku ingoa. I'm Sonia Peterson, the Practice Nurse Team Leader. Kia ora.
Okay, so our journey. We're pretty new to Health Care Home, so please forgive us if we get the terminology slightly not the Health Care Home way. Okay, our mission, Mori ora ki te mana Māori. We're about strong whānau, vibrant communities. We started in February this year, and just referring back to that delightful photo of the train wreck, I think we were beyond the train wreck, to be fair. We probably were, I'm not sure what we were heading towards, but we were certainly on a very burning platform that you hear of in a lot of change management theory. So we're a whānau-led organisation. We're not-for-profit, charitable trust. We achieved charitable status in 1985. We are an iwi-led, so we received no, to date, we've received no post-settlement treaty funding. We have received no funding from iwi. We receive our funding from the predominant agencies, government agencies. Ministry of Social Development is one of our largest funders, along with Ministry of Corrections and the Ministry of Social Development I've mentioned, and the Ministry of Health. Probably our larger funders now. Ministry of Health would be our lowest funder now, it would be fair to say. We are driven by whānau voice, and we've become really clear on that journey. So 4 years ago we started a relationship, a long-term relationship, which we forged with the South Central Foundation in Nuka, the Nuka model you may have referred to or heard of, in Alaska. We have been in that journey for 4 years. We've had a number of iwi delegations to Alaska now, And one of the things that has really predominated through that is the voice of whānau. We have increased our organisation. We're up to 300 staff. Our service specifically, we've got 50 services, but the service that we're talking about is Hauora Heritonga, which is a enormously high need population. We're 93% high need, complex comorbidity, very chaotic, very enormously stressful environment. 2 years ago, okay, I'm getting there. 2 years ago, it would be fair to say we had 27% attrition rate. Now, dealing with that actually becomes the activity of the day. You know, nice as it is to have models, but when you're on 27% attrition, actually your day's activity is around staff, really, staff management, unhappy patients. Going back a little bit, I mentioned whānau-led. Just to explain that a little bit more, we have 14 nominated trustees who are from our 17 marae across our rohe. We're made up of 6 tai whenua, and we traverse 435 kilometres from the north of Wairoa down to the southern part of the Wairarapa. I've mentioned this slide really, but a lot of contracts. We have a lot of contracts, a lot of letters of agreement and bits and pieces. Won't go too much into that. And I've mentioned 25 funders, and 12,000 in total in our organisation, 12,000 whānau that we're providing services for. So we started our healthcare home journey in January. We came and listened to the Pinnacle work that they were doing. We needed a solution. We weren't able or in a position to wait for a solution. So this seemed to be a bit of a fit. We'd been to South Central Foundation. We'd seen how we could organise our service better. And the thing that was alarming to us on that journey was the quietness. It seemed to be very organised compared to our hustle and bustle of our day. We did need a communication plan. We thought we deal with a largely low health literate population. We needed a communication plan. So we launched about 6 weeks. We set a date, the 4th of June. No idea why it was the 4th of June, but it was the 4th of June, and we thought, right, we'll work backwards. The most important thing that we established was a communication plan, or the need for the communication plan. I'm just going to give you a little demonstration of what we did over Facebook.
I'm Kiri at Te Tai Whenua o Heretaunga. We're looking at making some changes for you and your whānau. From June the 1st, if you think you need to see a GP urgently, please ring us and ask for a call back from your GP. Your GP will ask you some questions to see what you need. They might be able to give you all the help you need over the phone to save you from coming into the medical centre. This change is to help ensure that you and your whānau get to see the right person at the right time. Mauri ora whānau. Well, kia ora whānau, I'm Dr. Kiri Bird. I don't really like seeing my face up there, but it was really important for us to have the right face for the whānau. So having a Maori GP who knows the community really well was of utmost importance to put on Facebook so that whānau could relate. So yeah, Julia said we started after Queen's birthday, probably a silly date to start, but anyway, we did. And it required quite a lot of input in terms of getting checklists, and those of you who are already years down the track will understand this, but so checklists, educating our admin staff, educating our nurses and our GPs. And to be honest, our GPs really weren't that keen to do GP triage on the phone. We had a walk-in service where whānau were just able to, open the door and walk in. And so not many of us had done GP triage. So I'll talk about team culture later, but we spent a lot of time on helping our team become confident and spent a lot of time educating them around feeling safe and feeling confident for themselves, but also of utmost importance for the patients. On day one, we had 80 phone calls. And just to give you some perspective, so our walk-in service, we had a GP, so roughly would be seeing between 15 to 20 patients a day, your high needs clients, multi-comorbid. So normally the door would open at 8:30, and the first 20 that turned up would get in the door. Now they might not have been the sickest, it might have been number 45 that was the sickest, but the first 20 who got in the door got in and got an appointment. And so the first day where we had 80 phone calls, we were actually able to service an extra 60 patients in a service that we already thought was worse than the train wreck that you saw. So that was mind-blowing to us. Not only that, we were able to, the importance of time for patients. So you'd have your patient turn up at 8:35, and because they were number 19 on the slot, they would be waiting till 12, 1, 2 o'clock to have their appointment, so they'd be sitting there the whole day. The whole waiting room would be bursting at the seams. We'd be getting stressed, going out there, looking at it, going, who are going to be seeing all these patients? They would be getting stressed, and so it was just a very stressful environment. So yeah, the day one was telling and quite awesome to be able to service that many clients when we didn't think we even had capacity. So we then took some feedback. Julie's going to talk a little bit about feedback.
So I mentioned being whānau-led, and one of the learnings from South Central was that they were very serious about how they received feedback, and then, not just that, what they actually chose to do with the feedback. So it was walking alongside. So at the beginning of our launch on the 4th of June, what we prioritised was, for the first 2 weeks, let's call every whānau member who has been, who's had a phone triage contact. And we committed to hearing the voice of our whānau before we made any further changes or tweaks. Here's one of our stories, but two particular stories that ring out. One, a whānau from Otani, which is our rural community about 35 minutes from our practice. And she was able to be seen, she told me she was able to be on the phone. She's got young tamariki under 5. She was able to be seen. She was able to be scripted. She actually had a blood test. She could go to the local laboratory close to her. And she was just rapt that by the end of the day, she said, look, Julia, everything had been sorted. I didn't have to spend money coming into the practice. And to her, it was a real win. The second story, which did cause a few wet eyes, was one of our whānau with a 21 autistic child had been coming in, and we'd expected them to wait in our waiting room, and she was very whakamau, very shy, or very, she used to get quite distressed, the mother of her daughter, because of how vocal she was in our waiting room, and we'd put her through that. So it was definitely, we've been on a changing journey and a changing environment. Here's the voice of two of our kaumatua, Peter and Kahu.
Kia ora, my name is Kahu, and this is my husband Peter.
If it wasn't for Dr. Tanya last year, I wouldn't be sitting here today. Dr. Tanya sent me to the hospital, and I was told by Dr. Lowe, if I had got here about 15 minutes later, I would have been dead. She was one of the people that actually saved my life. There's a lot of people at Kariki. I've got my daughter and my husband. There's her husband who are pastors of a local church here, and all the family from the church. There's no, without Kariki, there's no power. And that's a good way to start the morning off at the Tai Whenua.
Just from that time when I rang Dr. Nara, and we only spent about maybe 5 minutes on the phone. His questions were concise, so I understood exactly what he was asking me, and I could answer. And then he was able to assess my problem. For a walk, and my knee was really in pain, and he asked me Oh no, I think he had asked me, prior to me telling him, he'd asked me what have you been doing. And I said, I've been walking around the block, but I went this morning and I came back and my knee was really in pain. He said, I think it's just arthritis in the knee. And then he said to me he could give me that ointment that would help the osteo in the knee. I said, okay. And then he advised me to get a knee bandage. We know our body and we know our pain threshold.
The other thing I really find good too about the service is that with the transport situation,
Yeah.
I'm able to ring up and I'll get blessed by somebody come around to pick me up because there's times when I can't get them. Yeah, because it's got to do with pūtea. Yeah, you know, I find that really amazing. I find that really awesome. You know, thanks to the management and the people like yourselves that run the service in Te Tai Whenua.
I just want to tautoko what he has to say, because I think that Te Tai Whenua has provided an excellent service.
I love our patients. I really do. Ngā mihi kia matua Peter me koia kahu for their kōrero. Leadership. So our whole ethos, our being is really for self-determination for our people. That's pretty much what we stand for. It's really important that we get the leadership right, the right people in the right places with the right kaupapa, standing for the right kaupapa. This is leadership. So we all come together, we all sing together, we all mihi together, we karakia together. And so that's what Te Tai Whenua o Here Taunga is about, which is what Peter was saying, start with karakia. In terms of strategy, we, as you've already, Julie's already alluded to, we went to Nuka, South Central Foundation. Our organisation has committed our whole exec to go, and some of us have actually been over twice. And it's really important that we brought back some of the insights from over there, because we know that what they're doing for their Indigenous population works for them. And so we knew there'd be similarities, and there are. And so we brought things back, insights back, and put our flavour over it. So we worked a lot on communications, which we're really good at. New Zealanders, Māori, we do whakawhanaungatanga really, really well. And in our organisation, that's a core component, a core concept of what we live by. So twice a year, we have full staff, 3 days, 2 times a year, where we work on, basically, it's Communications 101. So it's how we talk a single language together, and then those tools can then be used with our clients as well. So leadership is so very, very important. Us four, we lead the hauora, and so being present, being honest, being transparent in our huddles, in our meetings, when we get it right and when we get it wrong, and being open to feedback is also really important to us. So we're very open about learning, as we are here today, we're learning, and making mistakes is okay, but it's about how we support each other along the way. So that's a big part of our mahi as well. Team culture. So, as you can tell, teamwork's a big thing. We set goals at the beginning of the year, our little hauora, even though we're a much bigger tai whenua, we set goals. So, for example, our karakia that we did at the beginning was the second karakia on our set of goals. So all staff, Māori, non-Māori, are participating every day in tikanga te ao Māori. It's really important for us as an organisation, especially in the hauora, to make sure that all of our staff are upskilled in te ao Māori. And it's telling, so we've been working on this for a couple of years, and normally when someone passes away, so tangihanga is a big deal for Māori, and when one of our patients dies, often we'll go to the tangi, and the few Māori staff that we have would often go with our non-Māori staff, expose them, show them the tikanga that's involved. And just recently I was really proud that we had one of our nurses who's about 50, she's tauiwi, she's non-Māori, and we had a patient, one of hers, who passed away, and she whizzed past my office and she said, "Oh, I'm just off to da-da-da-da's tangi." And I poked my head out the door and said, "Oh, do you want me to come?" And she said, No, I'm fine, I'll be fine." And so her and a doctor from America attended the marae by themselves, stood and spoke at the appropriate time, backed that up with a waiata, all by themselves. And for me, coming from a Māori organisation and being Māori myself, that's huge steps forward, not only just for our staff and our tai whenua, but for our patients to have a really sound understanding of tikanga was so very, very important. So team culture and te ao Māori for us is huge. Giving staff, so at the beginning, and I know most of you who have been through this would have done this too, but we gave space regularly for feedback, good and bad, and we fronted it. So we were there to support the good times and the bad times, and giving people voice allowed risk for change. And we focused a lot on the positives because there were a few negatives, so we did lots of shout outs as well. Having flexibility within the templates, so we're not rigid. We used to be very rigid. Now we have flexibility for our staff to attend pōwhiri, so we hold pōwhiri for new employees every 2 weeks. So allowing them to come and participate in that, attend te reo classes. If paperwork's an issue, because everyone's paperwork's always an issue, then we allow time for that. So we're very flexible when we try to make sure that our staff are as looked after as our patients are to enable for a harmonious team. And then another part of our what we're trying to achieve in the last couple of years is really picking up on learning and development. So we're a learning organisation, and we're really proud to be open door learning about making mistakes, but then learning from those mistakes. And with a group of docs, it's often quite a tricky thing to achieve. We've also watched our healthcare assistant, which we call a whānau manaaki, grow. So it's every single member of our team is a valuable member. So Mere, who's was our admin reception staff, very quiet, unassuming lady. She started on reception. We moved her into a healthcare assistant position, and she now leads our huddles. And so to see her grow and over the 2 years has just been enormously satisfying. So every morning we're always like, "Where's Mere? Where's Mere?" It used to be, "Where's one of the four of us? You know, where's one of the leadership crew? What are they up to?" But now it's Mere runs the huddle, and Mere has the mana to do that. It's really awesome. Not only Mere, but we have our nurses all on, with our train wreck that was happening, what we decided to do is upskill everybody. So healthcare assistants, our nurses are all on the pathway to prescribing. So out of 5 nurses, 4 of them are there. And the one that was left is just out of net P. So that's huge for our whānau, our patients, being able to access people who can prescribe. We've got a pharmacist who's just about prescribing, and we have 2 nurse practitioners who work alongside the GPs, and we have one in training, and we have one ready to be in training once she filters out. So we've got this kind of pipeline of learners in the organisation, and it's awesome. All our GPs, not one of them isn't involved. Everyone opens their wing and puts someone underneath. Everyone has an open door. So we also recruit like that. If anybody wants to work in our organisation, you have to be part of the team. You have to have your door open. You have to have someone under or be under someone to move ahead in our organisation. And we're really proud of that. I've lost my notes. So yeah, GPs as well. So we're Cornerstone accredited and do the whole GPEP 1 training thing. So we have registrars and so on. And they also help to do the teaching too. And because of that, we give time, again, flexibility in the templates to supervise. So I have one whole or I have a half day of supervision back to back. It might be a nurse practitioner, a nurse prescriber, a GP registrar. So that's the commitment that our organisation makes to allow this learning organisation to prosper. And overall, what we're trying to achieve is self-determination for our people. So with that, I'm going to wrap up. We're very new at this. We're young. We're open to changes. We're open to making mistakes, but learning from those. And like I said before, outcome, self-determination and better health outcomes for Māori. Nā reira, tēnā koutou, tēnā tātou katoa. Join in if you know this one. Tu tira mai ngā iwi toru whā. Tu tira mai ngā iwi tātou tātou e. Tu tira mai ngā iwi tātou tātou e. Whai a te maramatanga me te aroha e ngā iwi kia tapatahi kia kotahira tātou tātou e tātou tātou e hi au wehi kia ora.